Hi Caroline, I have some good news. You're going to be going home later today, so I'm going to give you some instructions for what to do when you get home. As you know, you had a heart attack 4 days ago, and we treated you here in the hospital in the cath lab with an angioplasty to open up the block. And then if you're going to take 10 milligrams of nitroglyceride, and that should help give you some relief.
This is a picture taken of my family back in 2007. Soon after this picture was taken, my dad had a seizure and we had to rush him to the hospital. This is a picture of his brain that doctors found in the MRI. He had to have 4 brain surgeries in order to remove the clump of vessels that could have burst at any time. And after each one of these surgeries, he had this large team of medical professionals take care of him around the clock. And then he was sent home. From one day to the next, he went from having a team with over 50 years of medical experience take care of him to having to take care of himself with just 30 minutes of training. This system is not cutting it. 1 in 5 patients like my dad get readmitted to the hospital within 30 days, costing the healthcare system over $41 billion in readmissions alone. The good news is that over 60% of this cost is due to preventable readmissions. And that's why we built Pine Health, to make sure that my dad and the loved ones of everyone in this room gets the support that they need when they leave the hospital. With Pine Health, as soon as my dad leaves the hospital, he gets connected to one of our health coaches, a real person. On the back end, we make sure that our health coach is scalable. We take the doctor's orders and we translate them into actionable health tips that are sent to my dad via text message. And when my dad responds, we use machine learning algorithms to guide our health coach's responses back to my dad. We knew that we needed data in order to sell the system to hospitals. So this summer, we ran 3 trials. We engaged over 170 people via text message, including 20 to whom we provided a high-touch health coaching service to. And at the end of the summer, the results we got were amazing. We set out to show that people would engage with us via text message, and they did much more than just engage. They told us about their lives, about their families. They talked to us about their medical histories. And they even told us things that they hadn't yet told their doctors. Based on all of these results, we're excited to have a pilot coming up later this year with Mass General Hospital. We have an amazing team, and we have a group of medical advisors that include some of the best clinicians in the world. All of us have been on a mission to improve healthcare our entire lives. My mission started when my dad had that first seizure. Since then, I went on to invent a bioimpedance sensor that has been in over 2 million products. And I came to MIT, where I built machine learning algorithms for medical-grade sensors. And now, I'm at Pine Health, where we're building the technology to make sure that when you leave the hospital, you no longer leave your care. If you're interested in helping us help my dad and the millions of patients like him stay out of the hospital, please come talk to us after. Thank you.